Hi, I hope you liked our new introduction. Magandang hapon po. I am Dr. Ana York Bondoc and welcome po to our FB and YouTube live stream. Bago po tayo mag-umpisa, short commercial lang po. Please follow us on YouTube. We are looking for our subscribers po to reach 1,000. Our YouTube channel is Dr. Ana York Bondoc po. And hopefully, you can watch po yung mga replays namin doon. Please like and subscribe. Sa FB naman po, again, the same name, Dr. Ana York Bondoc. And please like, subscribe, and you can put your questions below. Sasagutin po natin for today. So what's our topic today? Our topic po today is about tetanus. That's in English or yung tinatawag po nating tetano in Tagalog. So this is actually a deadly disease na hindi po natin masyadong binibigyan ng pansin kasi sometimes we think wala na to sa Pilipinas. But actually, it is a very big problem. So, meron po tayong mga tinype po na true or false. And sagutin po natin yung mga true and false. And let's see how it goes, okay? So, before I'm trying to, send the true and the false. So, yun po. So, guys, there's a true and false po dun sa baba. Please project that kasi yun po yung magiging talk natin. Is that we will talk about the true and the false po. Dito po, sa sakit po na tinatawag po nating tetanus. So, let's start. Okay? Just be ready po to our moderator, Ms. Kat. And Ms. Reina, thanks for joining us. And ready na ba kayo? So, let's talk about tetanus. So, eto po, okay. So let's talk about tetanus first. Bakit nga ba napag-isipan natin itong talk na to? Well, last week, nag-upload po kami ng isang video na lumulusong po kami ni Benjamin, yung aking pong anak, sa irrigation canal. And marami po talagang nagtatanong during that question, during the video, marami pong nagtatanong, bakit po naka-shoes? So I wanted to answer that question kasi maraming nagtatanong po, naka-shoes ba tayo dahil natatakot po tayo sa dumi? Kung natatakot po tayo sa dumi, hindi na tayo lulusong, okay? So I wanted to answer that question and to expound on it more. Bakit nga ba naka-shoes? Okay? And I also wanted to clarify that I happen to be wearing rubber shoes sa video, but actually, kasi nagmamadali po, but actually, ako po ay may-ari ng shoes po na pambukid. So, pupuntahan po natin lahat yan. Okay? So, let's start. Ano nga ba ang tetanus? First of all, tetanus is a disease. And I think the first thing that we think about when we think of tetanus ay mga kalawangin po. So, ano nga ba? What is tetanus and how does it happen? Okay? So, and bakit ho siya importante sa mga tao po na nagtatrabaho sa bukid? Or why is this very important to people who are farmers? People po na, people who do manual labor like construction. Isa pa po, people na mga na-expose po talaga sa soil, sand, or yung tinatawag po nating sanitation workers, yung mga naglilinis po, those who collect our garbage po. And basically, people who work with their hands and their feet and are exposed po sa mga sugat na pwede pong mangyari sa kamay at paa at pupuntahan po natin yan later. So, for question number 1, ano nga ba ang tetanus? Sakit po yun, okay? Is it a virus? Is it a bacteria? It is a bacteria. So the bacteria po is called Clostridium tetanus or Clostridium tetani. Ito po, these are spread through spores and they enter po through wounds in our feet. So sige po, let's, do you want to do, siguro, are you guys ready with the slides? Let's do the slides first. Do you want to do the slides first or do you want to do the true or false? Slides
Doktora,
muna.
I-true or false na lang muna po natin, Doktora.
Ang cute no slides eh. Ayaw nyo?
After nun, parang mas magandang maumpisahan natin sa, ayan na po ang slide. Okay.
Ayan na po ang mga slides. Okay, thank you, Miss Kat. Okay, so what's this? Ano? Yan po yung spores ng Clostridium tetani or the bacterium called the Clostridia. It's actually anaerobic. Ano po ang meaning ng anaerobic? They do not need air to thrive, ano? So they do not need oxygen. They live po in the soil. They live po primarily in the soil, saliva, dust po. And they are drumstick shaped. Yan po yung pumapasok sa mga sugat po ng mga tao. Okay? Next slide po. So, eto po, it's a bacteria, okay? It's not a virus. So, ano po yan? What is that, nakikita nyo po ba? Ayan, lumalaki po, no? Yan po yung, it looks like an epileptic seizure, pero mas grabe pa po, ano? Yan po yung ulo on the left side and yung paa po ng tao on the right side. Tetanus is an ancient disease po, panahon pa po ni Hippocrates. Who is Hippocrates? The first doctor, yung sinasabi po nila. And it is marked po by what we call tetanic spasm. Ano ba tetanic spasm? Naninigas po ng grabe. Okay? It is truly a horrible disease. Sabi ko nga po, it's only secondary to rabies. Ako, natatakot po sa rabies. Natatakot din po ako sa tetanus. Okay? Because I personally have never seen a tetanus patient and I don't never want to see one in my lifetime. So kasi ho, bakit? Kasi ang meaning po ng tetanic spasm, tetanus is often called lockjaw kasi po the spasms start in the jaw. So parang hindi po nila mabukas ang kanilang bibig. But it then proceeds po throughout the entire body and talagang 24 hours a day, your muscles will be spasming. And those spasms po are extremely, extremely painful. In fact, sa sobrang lakas po talaga ng, what is the term siguro for a muscle? Parang maninigas po yung buong katawan nyo. And it is just so strong na may nababali pong mga buto and there are torn muscles as people undergo tetanic spasms. So it's really, 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 really scary. At hindi po na kahit hawakan nyo po yung pasyente, it's like an epileptic seizure. Hindi nyo po talaga mapipigilan. Yung epilepsies last for seconds, yung palang ho, nakakatakot na. Ang tetanic, kasi epilepsy is a form of spasming also. Ang tetanus po talaga, it will last the whole time until either the person dies or the person gets better. By the way, 10% po ang death rate ng tetanus. So it's really po a very, very deadly disease. Okay? So matindi po yan and you do not want to die this way, okay? So next po. Okay. So yan po yun, people often ask me, and ako po, I am not a surgeon. Usually ho, ang expert talaga sa tetanus are surgeons, neurologists po, and ER doctors. Okay? Bakit po? Kasi the ER doctors, when you have a wound and magpapabakuna po kayo sa tetanus, it usually occurs in the ER. Surgeons po usually man the surgical ER kasi usually malaki po yung sugat or maybe a vehicular accident. Ayan po, that is a scratch po sa kamay, ano? So yun po yun. That's why surgeons and ER doctors are involved. Yung neurologist po, because it's a neuromuscular disease. So there is often the thought po na ang tetanus po, kailangan malaki po yung sugat. Okay? Kasi mas madrama. Halimbawa, nasagasaan po kayo. Definitely, you would need a tetanus shot. But what people don't realize po, ganyan ho kaliit. That's actually a hand Pwede pong paliitan nyo po para makita nila how small this scratch is compared to the entire hand. So, talaga hong a scratch can cause tetanus. Ayan, kamay lang ho yan. So, you could see, no, ang nyo po talaga, if this happens to you, ikaw, Reyna, if you saw this, you're a nurse, ang inclination sometimes, wag na mag-ER, diba? No stitches naman necessary.
Ako, doktora, since I'm a nurse, alam ko right away na ito kailangan maturukan. Kasi po,
Yes.
number one, if you are unsure, sabi nga po nila, better to
Better.
be preventive and reactive, no? So, kung hindi man ito na tetano or na sugatan on a metal surface na may rust, maigi na pong turukan pa rin po. Yun po ang
Yes.
yun po ang ating protocol.
Very good advice, Reina. That is actually correct. So kung kayo po or yung anak nyo or what was playing outside or nagbabike po or may nangyari po, no? Napunta po talaga sa dumi ang sugat kahit po maliit, that person needs to be vaccinated po for tetanus. Okay? So the wound doesn't need to be big or dramatic. It just needs to be dirty. Pupuntahan natin yung statement ni Reina, which most everybody, Nurse Reina, which most everybody says po, na kalawangin. So pupuntahan natin yan later. Okay? But definitely, it doesn't need to be a big wound. Okay? Next po. So, ayan po. No, ayan po yung bukid sa likod ng bahay ko. Diyan po ako nagtampisaw ng isang araw. And why everyone is asking me, why are you wearing shoes or why are you taking precaution? Yes. We often think, as Miss Reina said, our nurse, that the concept po talaga ng kalawang eh. Yes, but actually, the concept po is really dirt. Why? Kasi po, the Clostridium tetani, they are spores, as I mentioned, they are anaerobic. They do not need oxygen. They thrive without oxygen. So they live deep in the dirt. And they can exist for a really, really long time. So, hindi po sila nalilinis lang o natatanggal ng ganun-ganun lang po. So, the most common po are, they are existing po in the soil. They can be passed through saliva, dust, and manure. Okay, manure. Ano ba ho ang manure? Yun po yung tai po. No? I hate to say that. I don't mean to be, bastos. Pero being scientific, para maintindihan, ito po yung dumi or tae po or dumi ng mga organic waste na ginagamit po natin usually sa mga fertilizers. So, nagpakita po ako ng bukid. That is actually the number one source of tetanus or Clostridium tetani spores that are existing po. So, dyan po talaga sila. That's where they live. And when you get scratches in your feet, if you are a farmer, or lumulusong lang po nang hindi nag-iisip, talaga pong pwede po kayong magkaroon ng tetano. Okay? So, it's very common among agricultural workers. Kasi po, nakababad, sa putik ang kanilang paa, they get, kaya nga, may nagsabi sa akin, takot ba kayo sa dumi? My answer is no, hindi po ako takot sa dumi. Ang takot po talaga ako yung suso. Kasi po, when you step on a suso, malalim po yan. Okay? Malalim. And then yung suso, nandyan po sa putik. Suso plus sugat plus putik equals tetanus vaccination. Sana hindi naman po tetanus infection. So, ililinaw ko pa lang po. Sa Pilipinas, the most common cause of tetanus infections are actually, I've seen two yung firecrackers po and soil. People do not realize that farming accidents require a tetanus shot kahit na ano po. Okay? Anything that happens in a farm, any sugat po that occurs in a farm should be vaccinated for tetanus. Okay? And I am going to go further into the issue na how often should you get a tetanus shot? It should actually be every 10 years. Meron pa nga akong some, I have read na every 5. Kasi po, these are booster shots. Bumababa po yung ating antibody level. So we need to get booster shots para tumaas uli ang ating antibody level. So if a child would get tetanus, or no, if a child would fall down, let's say, nahulog yung anak nyo, nagbabike, you don't have to panic too much kasi po, active pa po ang kanilang tetanus injection. And the last po is actually school age injection po, yung tetanus. Your last tetanus shot should be around school age, ano? But as you get older, nagwe-wane po yung inyong immunity. What's the meaning of wane? Bumababa po ang Would you mind to focus on me and not on the bukid? Nagwe-wane po yung inyong immunity. So your antibody level goes down. Siyempre, expert na tayo lahat sa COVID ngayon. Ano po? Your antibody level po will go down. So as you get older po, and what they say po, older farmers are actually at the most risk for tetanus. Okay? Older farmers po are at the most risk for tetanus. Okay? Bakit? Bakit ho older farmers are the most risk for tetanus? Kasi po, most of them, well, most of the farmers, ano po, syempre may bakuna program naman ho, no? Most of them got vaccinated when they were kids. So after 10 years ho, by the time you reach the age of 50, wala ka ng antibody ni isa, okay? So pag kayo po ay nakatapak po or nasugatan po yung paa nyo sa bukid, or maybe you were using the hand tractor or something like that po, pag kayo po ay nasugatan, your antibodies, especially if as you get older, wala na po kayong antibody. So you need the whole vaccination po talaga. Okay? So let's go back to the slides. So younger persons, when they get wounded po, they don't necessarily, at least, syempre you have to go to the ER and have it checked out. Hindi naman, lalo na po kung sa marumi. Okay? But older persons are particularly vulnerable po to develop tetanus. Okay, so we go to the vaccine. Okay, let's go muna to the ER. Okay, once we go to the ER, i-assess po nila. Sa ER po, hindi na po nila tinatanong eh. They no longer ask how long you had the vaccine. They immediately give you 2 shots. The tetanus toxoid po, and the antibodies po. So, napansin mo rin na dalawang shots rin. It's similar to rabies, no? Sa rabies, meron din silang antibodies at meron din silang toxoid. So, what is a toxoid? Ano po? The toxoid, yun po yung made from the inactivated neurotoxin. Okay? Hindi po siya, it's not the inactivated COVID or the inactivated or the inactivated tetanus. It is from the neurotoxin. Okay, kasi how does tetanus work? The spores po, they will reproduce in your body, and then they will produce po a neurotoxin. This neurotoxin po, yun po, they are the ones po that will block the release of neurotransmitters which relax the muscles. So hindi na ho makaka-relax yung muscle nyo, and you'll be stuck in the spasms for 21 days po talaga. Okay, so that is why the neurologist is involved, kasi po nasa neuromuscular junction po yung problema. So nakikita nyo po, that is a vaccine being administered. For children naman po, it's ngayon po they administer the tetanus vaccine, DPT ang tawag diphtheria, pertussis, and tetanus. I am not a vaccine expert for kids, pero binibigay po yon 3 series, the last school age. So, babakunahan talaga po kayo sa ER. And that is your 10 years. Okay? So, next po. Okay, I think that's it. Tapos na ba? Ayan. So, tetanus vaccine po, no? Kung talagang malalim at mukha pong dangerous, they will give you both the toxoid, that's the vaccine, and the immunoglobulins. Bakit po may immunoglobulins? Kasi po, even if you receive the vaccine, you will only start to produce antibodies po within 2 weeks. So kung talaga pong bibigyan na ho kayo talaga ng immunoglobulins for you, ito po na yung antibodies diretso. Kasi especially if it's an emergency, ibibigay na rin po nila yon. So I mentioned po that those at risk for tetanus are agricultural workers, people who do manual labor, construction workers, people po na naputukan po ng firecrackers, very, very, very important. And another one that I wanted to use to let you know was drug addicts po who shoot up intravenous drugs. Kasi po dun sa pagkagamit po nila, usually they use needles, hindi po natin alam kung saan nanggaling po yon. It is very dirty. So aside from HIV, these people po may develop tetanus. Okay? So, yun po yung ating discussion based on the slides. And let's go through the true or false very quickly. Kung wala naman, Miss Reina, you can read number 1. No problem kung hindi nila kung hindi nila ma-focus. It's okay. So, sige. So, tell me true or false, ikaw, Renz, ha?
Okay, wala po si Ate Reyna. Ako muna po yung magbabasa.
Okay, no problem, Miss Kat. Since you live in
Yan
San
po yung,
Luis,
opo,
okay, go.
yan po yung una po dun sa true or false. Letter A.
Okay, please. Please
Pinakamagandang
read.
walang sapatos habang naglalakad nasa bukid para nararamdaman ng putik.
Oh, ikaw, Miss Kat, true or false? Pinakamaganda yung walang tsinelas.
False ako eh.
Ayan,
Kasi
tama ka
natatakot
doon.
ako. Opo, kasi natatakot po ako baka may apakan akong suso, ganun. Baka
Yes.
masugatan.
Actually, those,
ganun.
you are actually correct. So, very good. Having come from San Luis, Miss Kat, correct answer. Bakit po, no? And let me tell you the story. Kasi po, nung nag-aararo po, gusto kong mag-araro rin. Actually, nakapag-araro po ako, no? So, I jumped in wearing rubber slippers. Obviously, dumikit po si rubber slippers, no? So, in-advise po ako. So, I jumped in without slippers and I was jumping around in the mud. In-advisean po ako ng mga nag-aararo dito, Doktora, please purchase. Bumili po kayo ng sapatos na pambukid. So, may sapatos pong pambukid. Sa mga hindi po galing sa bukid, you do not know this. So, I bought it po dito. It's not in the store, it's not in Lazada, and it's not in Shopee. O baka naman I should start selling, no? But, meron po talagang sapatos na pambukid. Ito po, these are very light. Itinatali po sa inyong paa. And doble po yung sa ilalim, tama, para hindi po kayo makaapak ng suso. At yung mga marurunong po talaga sa bukid, they do not just jump in. Kasi baka humatetanus sila. Okay? So, yun po yun. That is the knowledge po that you would need. So, it is fun po to jump around and lalo na po if you're from Metro Manila, like I am actually, kasi tsaka sa amin, sa Makabebe, wala na rin masyadong nagbubukid. So, masaya din naman ho to jump into the bukid with your shoes, without your shoes. But be reminded po na kung kayo po ay masugatan sa suso at malalim po yung sugat na yon, you are going to need a tetanus shot. Okay? So, next.
Okay, next po, letter B. Ang mga magsasaka ay advised na magpabakuna. True or false?
Ayan. So, I think I discussed this na, no, Ms. Kat? The answer is true. Wag na ho nating hintayin. Kung kayo po ay magsasaka, farm workers, ganun po, no? Be aware po na you need to have a booster shot po sa tetanus. At kung kayo po, be aware, kung wala po kayo, o matagal na po, di nyo na maalala, when you have a wound, you need to go po to the emergency room. Dito po sa Pampanga, you need to go to the RHU or kaya po to the district hospital para po mabakunahan ng tetanus. And habang mas matanda po kayo, as I mentioned, bumababa po yung antibody nyo nung 7 years old kayo, which is probably the last time ho na nabakunahan ng mga tao, hindi na po yun naabot sa 45, okay? I would like to tell you this story also. Ako po, how I became aware, I'm already a doctor. Hindi po ako, I'm not an ordinary person, but I was really not aware of tetanus. Though ako naman ho, I give tetanus shots sa PGH all the time. Dumaan din po ako ng ER. Okay, ito po yung kwento ko, no? And this is a social kwento for those who, sorry na lang, I'm apologizing in advance. So, ako po ay nagtrabaho sa New York for 7 years. That's New York City, USA, okay? Ang ganda ng kwento to. So, nauso po nung panahon na yon was to rollerblade or to roller skate. So, ako po, I was roller skating in Central Park. Name dropping talaga. Place dropping. But anyway, I was roller skating there. And hindi naman po talaga ako athletic. Aminado naman po. So, I was rushing down Central Park po, naka-roller skate. Mag-isa lang ako since I have no relatives in the US. So, and then I fell into a drain. Basically, I ran over a drain. Yung yung mga may doon, parang and I finally fell. I was on the road and then I got into the shoulder ba tawag doon? Basta may drain po doon, may drainage, okay? And ano ho, it was mga bars and then I fell there, okay? So dumudugo po yung paa ko. Being walang kamag-anakan po, I live near where I work. Parang tinanggal ko na lang ho yung skates ko at mukha akong luhaan na pumunta po sa ER. I was hoping po na lalagyan lang ho ng betadine yung aking paa. And actually, dumaan lang ho ako doon and my best friend, who's a surgeon, saw me. And I said, wow, nahulog ako. Instead of saying, like, being concerned po about my wound, the first thing po na ginawa po ng kaibigan ko, who's also a doctor and is now a very successful surgeon, ay naku, binakunahan ho ako ng tetanus. Sabi, before anything else, let's give you a tetanus shot. So dun ko po, that stuck with me. No, if you fall into a drain, a drainage, anything extremely dirty. And I'm sorry to tell you, I was already 26 years old. So lumipas na po yung 10 years ko from my last vaccination. Talaga pong kailangan magpabakuna. So doon po ako talaga naging more aware of tetanus as a necessary bakuna. Okay? So farmers should get vaccinated, construction workers should get vaccinated, and anyone who falls into a dirty drain, basurahan, ganun po, shovel, araro, hand tractor, needs to be vaccinated.
Ang tetanus ay makukuha sa pakong may kalawang. True or false?
Ikaw, Kat, true or false?
Siyempre, true po.
Okay, tama naman, Miss Kat, it is true. But, there's a misconception dito. First of all, hindi yung kalawang ang nagbibigay po ng tetano, okay? Kasi ako man, even though I'm a doctor, I kind of think that maybe it's the kalawang that's giving the tetanus, okay? No, it is the spores that are in the kalawang, which is dirty, di ba? Sinabi ko dirty. Yun po, the spores are there and they are the ones that are going to travel into your wound, okay? It is not the kalawang mismo that is gonna give you tetano, okay? And the reason that I don't like this statement about this kalawang na pako, talagang everyone's favorite is the kalawang na pako. Pakong may kalawang na pako. Ano ba to? Pakong may kalawang. Kasi it kind of makes us stop lang. Hindi naman ako napako, so okay lang. Yung pala na firecrackers ka na. Hindi naman ako napako. Yung pala, nasagasaan yung paa mo ng hand tractor and nagkaroon ka ng wound doon. So, 'di ba? Yun lang po, or halimbawa steel pipe, you are a bunch of workers and there was a steel pipe and you were carrying it and nasugatan kayo. Ganon. Hindi naman pako. Okay? So yun lang yung objection ko dito sa statement na at yung favorite ng mga tao yung pako. True. Pako, barbed wire is also another issue, okay? But more than that, people do not associate manure or soil with tetano. Tama ba ako, Kat?
Opo.
Parang, napupunta tayo sa pako parate. When we think about tetano, we only think about pako. Did you think about putik? Diba?
No
We don't. Kasi nga, nasa mind natin, pako. Hindi naman pako yun. But actually, putik, soil, manure, gardeners, hello, plantitos and plantitas. If you happen to get a wound while gardening, you need a tetanus shot. Okay? Lilinawin ko lang. Plantitos and plantitas, kasama po kayo rito. Okay? Next.
Parang nasagot na po ata to. Nasa lupa ang bakterya ng tetanus.
Yes, nasa lupa, nasa kalawang, nasa dumi po ng mga hayop or what we call po manure or fertilizers. So, ganun po. Or, yun po yun. It is there. Mga drainage, sanitation, trash can, yun po yun. Okay?
Okay, next po. Pangkaraniwan ring magkakaroon ng tetanus mula sa mga paputok o firecrackers.
Yes, tinanong ko rin po yan. I have this sad story to tell you. Nangyari na po yan when I was in interno. I was a clerk in PGH, and I hate to say this, somebody forgot to give a tetanus shot kasi po nagkakagulo na po sa ER. Okay? Talagang, well, you know, that's the ER of PGH on December 31. On January 10, the person arrived in a tetanic spasm. Nagkagulo po talaga. Because, well, that was a mistake po of the hospital. And, ano po talaga, that person had a hard recovery. So, again, kung naputukan po kayo ng firecrackers, yan po ay isang source ng tetanus. Okay, next.
Madali lang gamutin ang tetano, huwag mag-alala.
Naku po. Yan ang number one na mali. Tetanus is deadly, but 10% will die. Baka sabihin nyo, COVID 10% din. Okay, tama yon. But tetanus is just truly horrible. Can you imagine having contractions every day until the minute you die? Every 2 minutes or so, gumaganon yung katawan nyo, nakita nyo yung mama, parang halos po umaangat na po yung katawan ng tao dun sa kanyang higaan. And kahit na itali pa yun ng mga nurse, babaliin po nila yung taling yun. They have broken bones, they have, they have torn muscles. It is truly horrible. It is truly horrible. Wala pong gamot actually. I used to think there were antibiotics for tetanus. But upon researching po, no, the antibiotics are supposed to prevent further infections lang po. Ang talaga pong, akala ko penicillin but actually hindi po, no? It is a very, very big issue. And let me just, no? Ayun. Ang treatment po talaga ng tetanus po is the IVIG. Yun po yung immunoglobulins na lalaban po dun po sa neurotoxin. Okay? Once the neurotoxin is in your body, no antibiotic is gonna stop the neurotoxin po. And actually, the antibiotics po are supposed to prevent po na dumami po yung Clostridium tetani or what we call po the Clostridium bacteria. Pero hindi po siya talaga against the neurotoxin. So what they can give you po is IVIG, and despite this, it's a disease that will last from 3 to 21 days. Can you imagine having a spasm for 21 days until either gumaling po kayo or mamatay na lang po kayo? Aside from that, ano pa po ba? Diagnostics. Marami nagtatanong, how do you diagnose tetanus? May blood test po ba? There is no blood test. There is no x-ray. Pag nangingisay na lang po kayo, that's the time the doctor will tell you you have tetanus. Okay? How do you diagnose tetanus? There's what they call po the there's a test na ano ba to? The tongue depressor. Okay, may nilalagay po tongue depressor sa bibig. Tapos parang tinitikal po yung likod po ng inyong lalamunan. And then that will cause your jaw to lock. Ingat lang ho kayo as the doctor kasi they can bite your finger off. Okay? So, these people, they are, the patients, they are put in the ICU. They are completely sedated. Grabe po talaga. Parang halos pinaparilisado na lang po, no? And they very careful pag tinubo kasi yung paglagay lang po ng endotracheal tube here, mangingisay na naman ho yung tao. So it's really a very difficult disease. I have never seen it. Nabalita lang po sa buong PGH po yung nakalimutan po nilang bakunahan. And everyone, talagang let that be a lesson to everyone. So to everyone, tetanus, parang we don't think about it, no, inisip natin, hindi na nangyayari yun. But actually, people do die from tetanus in the Philippines. They are mostly confined po at San Lazaro. It is a very serious disease. And sayang naman po because it is a very preventable disease. So how to prevent po tetanus? Get yourself vaccinated every 10 years. Number 2 po, if you are a farmer or a construction worker or you have po mga wounds na nanggaling po talaga sa marumi, proceed po to the ER and get your tetanus shot. So yun lang po. So for those who are asking me bakit po ako nagsapatos, meron naman po akong sapatos sa bukid. Nagmamadali lang po ako. And the reason that I was wearing sapatos, sorry talaga, is because I am very worried about sugat po sa suso, and again, about tetanus. So, I hope that you will enjoy our video. Parang nagva-viral po. Our message there is to let children know po na mahalaga po ang pagsasaka at ang kultura po ng mga magsasaka. Pero bilang isang magsasaka, inform ko lang po kayo, ako po bilang isang doktor, pag kayo po, number 1, don't wait for a wound, get yourself already booster shot for tetanus. And number 2, kahit na po may booster shot, you still need to go and have your wound assessed by the emergency room. At malamang po, bibigyan pa rin ho kayo ng isang bakuna kasi po ang tetanus po ay talaga pong nakakamatay. So yun lang po. I hope that we are aware of a very serious disease na hindi po natin masyadong binibigyan ng pansin at ito po ay vaccine preventable. Ito po ang tinatawag po nating tetanus. So magandang hapon po.
From Miss Krista Diaz, Doktora, pasensya na po ako. Nawalan po ako ng internet.
Ay,
I'm back
naku,
na.
ganyan ang Pilipinas. Yes.
Yes.
Krista,
Go
how
ahead.
are you? Rains, Kat, please be ready to read yung, when I posted the tetanus, somebody immediately shared their experience. So as soon as you're
Okay
ready,
po.
let's read that. Oo. Kasi talaga
Sige
ako
po.
na-touch eh. Na-touch talaga ako. Na-touch talaga ako sa linagay ni ma'am. And I'm
Yes
really
po.
thankful for her for sharing such a painful experience. But maganda naman ho yung outcome, but let this be a lesson to all farmers. Opo, opo.
Sige po, hanapin ko lang po, Doktora. Miss Kat, paki-check nyo
I
muna
think
po
I
yung
sent it to you guys. I sent a screenshot to you. I am going to send the screenshot again para po makita nyo. You can just read it. Okay. Padadala ko
read
lang
it
po
na lang
yung
po.
screenshot.
Okay,
I'll
ako
read
na,
it na
Miss
lang.
Kat.
Okay po.
Sige.
Nakita ko na po.
Yeah.
From Miss Virin
Ayan.
Gonzalez.
Sige.
Tatay ko po na tetanus sa bukid. Tapos sabi niya po, nagamot po siya sa San Lazaro Hospital. Awa po ng poon, nakasurvive siya. Sabi niya, ang hirap-hirap ng inabot ng tatay ko. Yun po, ma'am.
Yes, talagang, talagang na-touch din po ako sa sinabi niya. And ako rin honestly, I never thought na farmers, kasi di ba we keep thinking of this kalawang and these firecrackers kasi. Last summer, I was talking to a person here outside my house. Sinabi po niya that her father, I don't know how we got there, parang nakumusta ko ata yung tatay niya. And somehow po, nabanggit po that her father died of tetanus. So na-shock din po ako because after the PGH person na hindi po nabakunahan, and I do not mean anything wrong to PGH ha. Nagkakaroon din po naman ng pagkakamali and we all learn from that and thank God po naman na nag-survive din po yung tao. And halos gera naman din po talaga on December 31, but again, that is not an excuse. After that, immortality po, I never heard of anything about tetanus again. And then yung visitor po namin told me that her dad died of tetanus. Somewhere po dyan sa Candaba. So I was really in shock because parang may namamatay pa ba? And unfortunately, the answer is yes. The answer is yes. So I'm very glad po kay Ma'am Viring na nakasurvive po yung father niya. Pero as the daughter po of the person who got sick, talagang aminado po siyang napakabigat po talaga ng nadaanan. And I'm so glad po that, first of all, that si tatay po survived. But again, I'm also happy po na na-share niyo po yun. Because ako na po itong doktor. Actually, my husband is more aware because he is the owner of the farm and the farm manager. So talagang, we were talking about it yesterday. Sabi niya talaga, kahit anong sugat, diretso bakuna. Okay?
Sa amin po, Doc, parang natisod lang po yung buto ng manok ata. Tapos yun, nilagnat po, tapos namatay.
Yun.
Tetanus din po
It's
yun.
very difficult. Yes. Yes. Ito pa, yung mga natataring mga tao sa cockfighting, ha? Kasi di ba may tari yan? Yung mga natatari, that's also a dirty wound. Please, guys, ingat lang.
From one of our viewers, Doktora, nakakatakot daw talaga ang tetano. Yes.
Naku, it's really scary. Sabi nga po nila, there are two super scary, and ako po, sanay ako sa namamatay. I'm in charge of an ICU. I am not scared of the dead and the dying. Pero I am really scared po of the rabies and the tetanus. honestly, I am scared. Opo. Kahit anong sakit haharapin ko po, including stage 4 cancer, I am not scared. But I am really, just really scared. That rabies, tetanus, and meningococcemia. Meningococcemia talagang I can't stand that. Pupuntahan natin si meningococcemia para malalaman niyo po talaga what is the problem po. Ang meningococcemia is very scary kasi everybody around can get sick. Kasi I remember that I was in New York naman and then there was this person po na nagkaroon po ng parang was getting spots, yun po yung sign ng meningococcemia. In 1 minute, pinalabas po kami ng boss namin. She said, get out of this room. Otherwise, baka magkasakit po kayo. Nagtakbuhan kaming palabas. So, ako, Reyna, naharap ko ng HIV. I'm not scared of HIV. I'm also not scared of COVID anymore kasi may PPE na. But 3 diseases that are really terrifying to me are rabies, tetanus, and meningococcemia. Yun lang po.
From one of our viewers, Doktora, may antibiotics ba for tetanus?
Actually, that's a good question. I used to think penicillin, pero further reading about tetanus po and further understanding ngayon, kasi alam mo, we learn more about vaccine preventable diseases ngayon as we go through COVID. Dati hindi, Diyos ko rin na, yun ang masama eh. You know, may bakuna naman is what people always thought. Okay? Ako man personally, honestly, I don't even bother to know about the other diseases because my opinion is may bakuna naman and let's move on na lang to cancer and cardiac disease. Sorry talaga, but really I am a cancer specialist. That is my favorite topic. And anything about cancer, I get so excited, ano? Because of the thought na may bakuna naman. This thing about COVID really taught me so many things and so many truths, not only about myself, my family, but about medicine and the way I practice medicine in general. Parang nagkaroon din ako ng eye-opener. Kasi dati, I used to sleep through everything except cancer. Kasi yun ang gusto ko eh. But it has been an eye-opener. So, yan po yun. Antibiotics not really helping pala. IV, in immunoglobulins. For those who are interested in COVID, immunoglobulins po ang bago ngayon sa COVID. Dito po, ito po yung direct antibodies. Okay?
Okay. Next po, Miss Kat. May tetanus po ba sa kids?
Ay, magandang tanong yan. Thank you for asking that. There's what we call po neonatal tetanus. And again, unlimited po yung ano ko because I'm not a pedia and I'm not gonna pretend that I know. What I know po talaga is that it's common in the developed world. Nangyayari po yun from dirty childbirth is what I understand. Yung pagputol po ng puso is not so clean. So, nagkakaroon po ng, ng tetanus. It's what we call neonatal tetanus po. The kid gets tetanus, especially po if they do not receive antibodies from the mother. So, actually, tetanus is one of the things po na dapat, I'm not an OB again. Diyos ko, dami kong I'm not. Pero talagang, cannot know naman everything eh. So, pag pregnant po kayo, have a talk with your obstetrician po. Lalo na po, it's very rare in mga high-tech places. But yung mga nanganganak sa sa ospital, of course, it's not gonna happen. Sa Philippines, hindi na po tayo nanganganak sa bayan like before. Pero noong unang panahon po, marami po talagang neonatal tetanus. Okay?
Okay. From Mr. Rolando Bondoc. Delikado kapag nakatapak ka ng pako sa patubigan o kaya sa bukid.
That is actually correct, sir. That is very correct. At hindi
Doktora,
lang po pako, any kind of wound po sa bukid.
yes, ako doktora, maidagdag ko lang ha. Yung magkaroon ka lang ng open wound, nakakatakot na po yun. Kasi ang dami-dami pong mga bacteria and germs na pwedeng pumasok from the open wound. So, kaya po talaga ang tetanus is real po talaga.
Alam mo, Reina, thank you for sharing your thoughts on tetanus. And I would like to confess why I don't know much about tetanus. And I'm actually guilty of this, okay? First of all, kasi Number one, may bakuna naman. So like the heck, who cares? Okay, sorry. Ganun talaga kami mga doktor. Kasi may bakuna, I don't wanna hear about it. Ang dami ko nang inuwang problema pa. Okay, and I am sorry to tell you the second reason. Second reason, hindi naman ako nagtatrabaho sa ER. Okay, I'm not an ER doctor. Okay, I'm an internist and an intensive care specialist. I don't want to deal with that, and I do not need to deal with that. And the third, ito na po yung talagang sad. Not the second, the third was really sad. And Reina, I would like to apologize to all nurses with what I'm going to tell you, okay? The reason that majority of doctors don't know much about tetanus is iniiwan po nila yung bakuna dun sa nurse. O ano, Reina, hindi kaya tama yon? And then sisigaw na lang po, nabakunaan na ba yan? Oh. So because we
True,
think of it as a
Doktora.
job of a nurse, parang we don't really put our minds and thoughts into it. But actually, it is so important. Am I saying something that's correct, Reina? Do you feel that?
That's right, Doktora. Actually, may, in fairness naman sa mga doctor, I would just like to commend also the doctors. Ang doctor po kasi talaga magra-rounds lang po 'yan. Mag-uutos, isusulat po kung ano yung mga dapat na igawin sa isang pasyente. Ngayon, kami pong mga nurses, naka-checklist po 'yan. Sanay kami sa checklist. Pero hindi po umaalis ang doktor nang hindi kami binabalikan. Meaning to say, babalik po si doktor pag natapos na po lahat ng rounds, i-check niya po, nagawa ba to, nagawa ba to, nagawa ba to, nagawa ba ito. Kaso po, pagpasensya nyo na ang mga nurse, minsan, nakakalimutan na nila, lalo na po sa San Lazaro. Napakadami ng tinuturukan po ng, nakapag-duty na po ako doon, doktora, sa mga rabies po ng mga pasyente, mga narabid po na pasyente. Ay, Dok, iba po. Tama po yung pagkakasabi niyo po kanina na halos parehas ang simptomas po ng may rabies sa tetanus, yung nanginginig, nagkakaroon ng parang epileptic scenario. Totoo po yun, nakakaawa po sila, para, sorry for the term, pero para po silang asong na nawawala po sa pag-iisip. Totoo po yun. Kasi po, yung tetanus po is mineral, magnetic mineral po siya. So tapos po yung ating mga brain cells is puro neurons. Pumipitik-pitik po 'yon. So pag nagtama po silang dalawa, kaya po nagkakaroon ng motor, di ba po,
neurotoxin. They are
yes,
both rabies and tetanus are both neurotoxic. So
yes,
they are
po
extremely scary na sakit. Scary for the patient, of course, for the patient's family, and also extremely distressing po for the doctor, and worse for the nurse kasi the doctor will just hide po dun sa corridor. Tapos gagawa-gawa na lang ng notation dun sa chart, Reina. Pero the
true
poor nurse has
yan.
to deal with all of this. So,
Actually,
kawawa po lahat. Kawawa lahat.
Actually, Doc, mas gusto ko pang makakita at mag-alaga ng pasyente well, wala naman akong gusto talagang alaga ang pasyente dahil ayaw po natin yon. Pero mas gugustuhin ko na pong makakita ng psychiatric patient versus dun sa nararabid na pasyente. Nakakatakot. Wala po talaga sila sa sarili nila.
And the second is, aside from nakakatakot, number 2, nakakaawa. Okay? So sana let's not let these things happen. Kung kayo po ay nasugatan, please immediately go to the ER po and demand. Hindi lang po requested, demand rabies shots. Okay?
Tsaka ito lang din, Doktor. Opo, maidagdag ko lang din po. Kami po ay nag-review ng mga video po na pinost ni Doktora. Sa mga natatawa lang po dahil naka-rubber shoes siya, napakaganda po ng kanyang ehemplo. Gusto ko lang pong sabihin sa inyo kasi po, kung hindi po nag-rubber shoes ang doktora po natin, maaari po siyang matusok sa mga pako, or hindi man sa mga pako, alam po natin na madaming matutulis na bagay dyan. Kaya po hindi po 'yun isang kaartehan, 'yun po ay isang tamang precaution.
It's a safety precaution. Yes. And I do own Bukid shoes. Benj, can you call Mr. Lumagi? I'll show my Bukid shoes here during the live.
Opo.
Okay?
Wag po kayong maliligo
Benji,
ng
makinig ka. That's why you need to wear bukid shoes. Benji refuses to wear his bukid shoes.
Ay, naku po, wag po ninyong kakaligtaan na maglagay ng
Ngayon that I reviewed this
protect.
tetanus, talagang itatali ko yung sapatos na yun sa paa niya. Bahala siya doon.
Okay, meron pa po ba tayong mga nagtatanong, Miss Kat? I think madami,
Okay na
Doktora.
tayo. I think bumati na lang. Sometimes we don't even
Sige
mind
po.
na yung bumabati. So rude.
Actually, Doktora, ang dami pong nakipag-comment sa atin ngayon. So, yan, katulad
Sige,
po ni
let's naman.
Opo, ni Miss Lanlan M. Mesia, Doc, kailan po dapat magpa-inject ng tetanus? Gaano ba kalalim ang sugat at ilang araw ba ang effect ng tetanus?
Ma'am, yung sapatos po nating pambukid, sir. Opo. So, kahit yung kay Benji. Ma'am, the moment you get, I don't even want to know eh. Ako talaga, I'm so scared of tetanus that the moment nangyari po yun, you should rush to the ER. Parang rin ho eh, I have to say mas aware ang mga tao sa kagat ng aso eh. Tama ba ako? Ako ikaw, Kat, you live in a barangay, di ba? Parang the moment may kinagat, takbuhan na sa ER, which is good kasi rabies. But parang hindi natin na there's also another disease po called tetanus na na kailangan. So I would suggest po, pag kayo po ay nasugatan, immediately clean the wound. Totally clean the wound. Opo, soap and water. And then go po talaga to the ER to get your tetanus shots. Gaano kalalim? It doesn't need to be very malalim. Depende po talaga kung saan po nangyari. Yung mga po, and let the ER decide po what kind of treatment that you would need. Kasi may gradations din po yan na sugat. Like, kagat ng aso. It also depends kung saan, kung gaano kalalim, what is your vaccination status. So, i-assess po yan ng emergency room. Okay?
From Miss Eden Inting Acero, hi Doktora, good afternoon po, watching from Hong Kong.
Hi, ma'am.
From Miss Marites Manliklik, may injection po ba sa tetanus hanggang 5 years ang epekto?
Yes, 5 to 10. I have read some 10. I've seen some 5. So, pa-assess nyo na lang po talaga.
Bakit every 10 years ang bakuna?
Bakit? Okay, kasi ganito po yun. They have, first of all, this is a really old vaccine. 1924 po ang unang bakuna po ng tetanus. Kasi talagang nung unang panahon talaga, Reyna, people were really dying, lalo na the world was very agricultural, 'di ba? Nung So talagang ang dami talaga namamatay ng tetanus right and left, okay, nung panahon na 'yon. So finally, 1924, they developed the vaccine. And why after 10 years? Kasi po yung antibodies po natin, pinag-aralan na po ito ng mga doktor, they go down significantly after 10 years. Okay? So, bumababa po talaga yung ating, why antibodies? Yung antibodies, yun po yung lalaban dun sa neurotoxin. Kailangan po marami po tayong antibody. After the 10 years, nalalaman po ng mga doktor na bumababa na po ang inyo pong dami ng antibodies after that time. So, you need to get what we call a booster shot. Okay?
Okay pa po ba kayo, Doktora? Kasi po, madami pong makipag-usap sa atin tungkol sa ating topic.
Maikli na lang yung sasabihin. Okay?
Sige po. From Miss Sonia Taruk, Doktora, salamat po at na-discuss nyo ang Clostridium tetani. Pasensya na po. Important po sa mga nakaapak nating magsasaka. Marami pong suso na pwedeng makasugat. Opo, Doktora, tama ito, Dok.
Yes, ma'am. Actually, ako man, I'm guilty of not knowing this. Nagulat na lang po ako nang may visitor nga po dito. Yung tatay niya namatay po ng tetanus. Kala ko po, sometimes when you work in a big hospital, and guilty po ako dito, like, may namamatay pa ba niyan? The answer is meron. Hindi ka lang aware. Hindi lang ako aware. And Reyna, mabuti ka pa, you went to San Lazaro. Yung husband ko po, being UST, also went to San Lazaro for a rotation. Kami po, PGH lang. And honestly, I would like to admit to you that I'm scared to go to San Lazaro. Kasi I'm scared of rabies and tetanus.
Dok, madami. Ito, ganito kalungkot ang sitwasyon sa San Lazaro. Meron silang isang um, parang isang hallway doon. Mga nakatali na yung mga tao.
Oh
Ganun
my
po siya.
God!
Kasi po
Reyna,
nagwawala
hindi
na
kaya
sila.
yan.
Nangangagat, nagwawala, tapos nagdudruling na. Ibig sabihin po ng
And that
drooling
is
yung
not the psych
naglalaway
ward,
na.
okay? That is not the psych ward.
That's not the
The
psych ward
tetanus
po.
and the rabies ward. Oo.
Yes po. Dok, talagang naglalaway sila, nagluluha ang mga mata, yung mga sipon tumutulog. Ganun po siya katindi. Kaya po, seryosohin natin ito. Hindi po katatawanan ng ginawa ni doktora nung nakaraan. Isa pong itong ehemplo. Okay
Buti
po?
ka nga, Reyna, you were able to do San Lazaro. Ako, aminado ako. And I'm a very brave person, ha. I wouldn't naman go into ICU kung mahina loob ko. Pero I have to say that might be a situation talaga na I will need to have extra prayers and strength talaga. Kakayanin ko naman kasi naging doktor naman ako na, but I don't want to do that. By the way, the maternal grandfather of my mom was one of the first directors of San Lazaro, Dr. Catalino Gavino. And actually, there is a stamp. So, dapat hindi ako takot. Okay? Go. Kaya ko
Yes.
yan.
Dok. Dok, sa may HIV naman, nakaka-depress kasi lahat sila parang nawawalan na ng pag-asa. No?
Ay,
Doon din sa
wag.
San po
Pupuntahan
yun.
natin yan, Reyna. There is hope. Okay?
Yes.
Ako, I grew up, I not literally grew up, but I went to the US at the height of the HIV crisis. And parang naging yon, parang that was a test of fire for me. And I have to say that nakayanan, I was really very afraid. Nakayanan ko rin naman po. And I developed po a compassion and an understanding for the patients who have HIV. Yun naman po yung maganda doon.
Yes.
Kasi we have to
Okay.
grow eh. We really have to grow. Okay? Sige.
From Miss Sonia Taruk, yung iba po kasi akala nila sa alambre na may kalawang lang nakukuha ang tetano. Basta't madumi, pwedeng may naninirahang close tetany.
Yes,
Dok,
ma'am. That's
sa
thank you. That is really truly correct. I think I talked about that with Kat. Kung minsan yung issue of the kalawang and the nail, hindi na tuloy, parang hanggang doon na lang. There is an awareness, pero like for example, na sugatan na suso, wala namang kalawang doon. Oh. So, hindi po nila alam na soil, I didn't even know manure. Dumi po yon, organic dirt. Okay? Otherwise, yun yung mga dumi po ng mga baboy and dogs and whatever, and they use that for fertilizer, chicken also. Manure, okay? So if you are a recycler of manure, please be aware.
ito nga, kami dito di ba na ilang beses, nakatira po ako sa Pasig. Ilang beses kami lagi na-flood dito, nababaha.
Isa pa yan.
Automatic po kami na pagka lumusong ang isang tao po sa amin sa baha, whether may sugat or hindi, ang barangay po namin ay nagtatawag po para magpaturok po agad ng anti-tetanus. Totoo po yun, hindi po kami
Yes.
meron pong pondo ang Pasig para po sa anti-tetanus.
So yes, I did not touch upon that, Reyna, but it's true. Kung lumulusong po kayo sa baha, please be careful.
Okay, next po from Miss Kat. From Miss Zarina Claire. Good afternoon, Doc Ana. God bless you, your family, and team.
Thank you, ma'am.
From Miss Barbie Taruk Olap. Hello po, Doktora. Naka-4 na dose po ako sa anti-tetanus vaccine nung time na buntis pa po ako. Ilang dosage po or session ng need para lifetime na effective siya? Yung sinasabi na kahit makaapak ka ng may kalawang, graduate ka na po ba sa tetanus?
Ma'am, eto lang Thanks, Ma'am Barbie, for this very beautiful question. Hindi yung dami. Like, for example, you got sorry, let me rephrase my answer, okay? Why bakit sa ER hindi na sila nagtatanong, diretsong bakuna? Kasi po, most of the people, they don't remember. And then some of the people po, they remember, pero mali. Yung akala nila naturukan sila, yung pala hindi pala tetano yun, but wrong because of the difficulty po, o nahabulin po yung sakit pag nang umpisa na, most people just get vaccinated on the spot. Okay? On the spot. parang wala nang tanungan. Okay? So every 10 years po talaga, there is no such a thing as being graduated. Kasi even if you got turok twice, say between 50 and 55, kasi 55 nahulog ka or whatever, no? And then naturokan ka lang, you have to wait 10 years again from 55, then you need another turok po. So actually, the most vulnerable po talaga sa tetanus is older persons because malayo na sila dun sa huli nilang bakuna. Okay?
Okay po. From Miss Remedios Nogoy Jeronimo. Dati po safe dahil wala pa pong suso noong araw. Ngayon po sa dami ng kuhol, delikado na.
Actually, ma'am, you are very, very correct. And that's, I posted a kuhol picture before eh. Yun po yung kanilang golden kuhol. The name is so nice, but the action is so bad. Peste po yan talaga sa bukid and now a source of tetanus. So, yung mga iniisip po ng mga tao na masaya pong lumusong nung unang panahon walang golden snail. Ngayon po, those things are deadly for the palay and deadly for the farmer. I would like to share with you my picture of my shoes. Eto po. Do you see it? Ayan po. Tanggalin po natin ating pangalan. Ayan. So, eto po, no, I wanted to share.
Pwede akong comment? Diyos ko naman, akala ko naman kung anong rubber shoes ang pinagko-kontrobersyahan ng mga tao.
No, I was wearing rubber shoes. I really was. No, I was really wearing rubber shoes kasi I was in a hurry. So I didn't wait not to wear the shoes, but I own this, okay guys? I'm not, tingnan nyo po yan matigas po yan, double, po yan sa ilalim. And then they tie this around your ankles. You cannot buy this, okay? Ginagawa po ito sa mga farming communities. Benji has his own shoes, okay? So you wear this, it is light, okay? You wear this kasi talagang makapal yung ilalim niya talaga, okay? And this is what farmers really use. These are called, sa amin, sapatos na pambukid. It's really good.
Doktora, akala ko naman kayo ay naka-Nike or Adidas sa
No, hello, I was wearing when I jumped into the pool, I'm wearing the rubber shoes now. Ayoko lang pakita, no? But Benj, can you hand me my rubber shoes?
She's wearing rubber shoes nung lumusong siya.
Yun na nga, Miss
I was wearing
nagpa-viral si Doktora ngayon.
I wanted to say, I am the owner of the proper shoes, okay? Yes.
Doktora, you need to make a video again na yan na yung suot mo.
Siguro nga. By the way, yung suot kong sapatos, ito po, Saucony, okay? Saucony. Branded, okay? Branded. May humihingi nga ng rubber shoes. Saucony po yun. They're actually running shoes. Naksa, naka-running shoes pero hindi naman nagra-run. Okay.
Marami pa ha.
Sige, keep going.
From Lanlan and Doc, yung po bang nakagat ng aso, hindi din po ba magpa-inject ng anti-tetanus? Nakukuha rin po ba sa baka ang tetanus?
Yes. Wonderful question, Lanlan. Sorry, inunahan na kita, Ma'am Rains. Masyado ako na-excited. And I would like to tell you, yung anak ko po was scratched by a dog. So, he got both an anti-tetanus shot and an anti-rabies shot.
From Miss Emmy Manalo, noong buntis ako, pinaturukan ako ng anti-tetanus.
Yes, ma'am. That is for the neonatal tetanus.
Okay. From Miss Emmy Manalo again, meron IST dose and second dose. Every time pagbuntis ako, natuturukan ng anti-tetanus.
So actually, I'm glad that you mentioned that, okay? Kasi the people who get pregnant, obviously, are the ladies, So they got the tetanus shot while they were pregnant. Ang lalaki po, obviously, hindi na pre-pregnant. No reason to get a tetanus shot. Nakuha mo yun, Reyna? So actually,
yes po.
The males, when they step on, or a nail or natare or whatever, mas ano sila, mas at risk ang lalaki. Kasi ang babae nabakunahan ng buntis. Na-gets mo yon. Whereas ang mga lalaki nabakunahan lang when they were kids and after that wala na po. So actually, it is more of a risk po for older males.
From Lanlan and Messiah again po. Doc, last question. Effective
Sige po.
po ba yung ginagawa sa province na isinasawsaw yung tabako sa langis at sisindihan tapos ipapatak sa sugat na napako? Naranasan ko po kasi yon sa probinsya. Minsan daw po pulbura ng posporo ginagamit din tapos sisindihan sa sugat. Thanks po.
Ako po, I haven't seen that yet. Okay? But I can't also say yes or no. What I could suggest was to clean the wound po talaga and then to proceed to the ER. Ikaw, Reina or Kat, are you familiar with this?
Dok, naririnig ko po siya kasi para siyang traditional practice.
Traditional Baka naman ho talaga meron. There could be some points to that. Thanks, Reina, for sharing that with me. Pero ma'am, scientifically, ako pa, hindi ko pa parang ayoko kong umasa doon because of the fact that tetanus is such a deadly disease and very painful.
From Miss Elisa M. Dungo, Doktora, hanggang kailan po ba na-expired yung anti-tetanus after na maturukan?
Ma'am, 10 years. Kaya lang, sometimes people trying to tell the nurse in the ER na nabakunahan na sila, the nurses don't wanna hear that. They just want na bakunahan kayo uli. Kasi kung minsan ho talaga, mali po yung pag-aalala natin. Yung pala, hindi pala tetano yung bakuna nyo. So, sige, para wala na hong tanungan, bakuna uli.
Actually,
Eto
Doc,
lang ha. Oo.
Go
Ikaw,
ahead.
Rina, what do you think of that?
Opo, at saka Doc, nakakaroon din po kami ng mga cases sa hospital na kahit na-scratch lang po sila ng pusa, ng nakagat ng daga, bukod sa anti-leptospirosis, yung gamot po doon, and nagtuturok din po ng anti-tetanus.
Ay, tama yun. Daga at saka pusa.
Opo, bukod po sa aso, Doc.
Daga at saka pusa.
Opo.
True.
Okay, next po, Miss Kat. Miss Elisa from Miss Elisa M. Dungo, mga pasaway po kasi ibang tao, kaya tawa agad sila first time. Nila makita na lumusong sa tubig po. Nainis nga po ako dun sa mga nagsabi ng maarte. Relax
Don't
lang
worry,
tayo.
ma'am. Maarte talaga ako. But, aside from, you know what, being maarte is not necessarily a bad thing. It's okay. Babae naman ho tayo, so may karapatan tayong maging maarte. And
Agree.
it's a right of women to be maarte. Okay,
Agree.
guys?
Yes, arte.
Ikaw, Kat. It's a right of magagandang babae, mas lalo pang makarapatan. But regardless kung maganda ka o pangit ka, you have your own femininity and lalabas yun. Okay? O ikaw, Kat, agree? Karapatan natin
Agree
yun.
agree ako.
Ay, naku. Tawagin mo ako maarte talaga ako.
Ang mga
Saka
staff
yung mga
ni Doktora, kami po ay maaarte. Kami din po. Totoo po yun.
Kasi magaganda kami. Sorry, feeling din kami.
Feeling ko nga mas maarte pa tayo, ate.
Totoo po, si Doktora po, napakasimple pa po niyan. Pag nakita niyo po ang mga staff ni Doktora, malalaman niyo po ang...
Hindi, like boss. Hindi, matino kayo before you started working for me and then nahawaan na lang kayo.
Naku, kailangan po. Kasi po ang Doktora hindi po papayag na mukha tayong gusgusin po. Ayaw po niya yon.
Alam mo, ang motto ko talaga sa buhay, and this is really true, I tell all my employees this. You know what? The Lord did not give everybody beauty. And beauty fades. Kaya lang, yung inyong attitude at mag-ayos naman kayo ng mukha at saka buhok pagkagising nyo. Because even the most beautiful person, pag hindi nag-aayos, can turn out to be not beautiful anymore. Diba? So, there's such a thing as beauty and there's such a thing as good grooming. Sana mahulog tayo dun sa good grooming. Ngayon, kung pinanganak ka maganda at may good grooming ka pa, all the more the better, diba? Ngayon, kung hindi ka naman pinanganak na maganda but you are making an effort, go na go yun.
Yes, agree.
Sige
Okay
po.
po. From Miss Benny Bondoc, hello po, Doktora. Musta po? San Roque, Toda, President po.
Hi, sir. How are you? And good afternoon po. Is this San Roque San Luis or San Roque Macabebe?
From Miss
And
Wilnor,
shout out po sa mga TODA members ng San Roque.
shout out po. From Miss Wilnor Santos, hi po, magandang hapon po. From Isabela po ako.
Hi, sir. How are you? And good afternoon po.
Dok, this is all for today.
Okay, good.
Napakaganda ng topic, napaka-fresh breath po, 'di ba? Parang this
Alam
is
mo, yeah, it's really, I like talking about different things, you know. There's such a thing called COVID fatigue na rin, Reina, you know. Parang we're all COVID experts, my God, di ba? Hindi mo napansin, the moment may narinig na may COVID, may opinion na yung nanay mo, may opinion yung tatay mo, may opinion yung barkada mo, may opinion yung Viber group nyo. Kung minsan nakakaganon eh. So, you know what?
totoo.
Di ba parang they're experts? Parang everyone is a contact tracer today, okay?
Doktora, ito nga ang nakakatawa dyan. So, nag-hire ako ng mga bagong kasambahay po namin ngayon. Ang una kong tinatanong, naniniwala ka ba sa COVID? Kasama na siya sa interview question ko.
Talaga,
Would you believe
kailangan.
that?
No, kasi syempre, you know, if somebody doesn't believe, di hindi siya na mag-iingat, di ba? And we all
Exactly.
now are gonna be living in the same household. So, kailangan yung attitudes nyo are you share the same values and attitudes with regards to pag-iingat sa COVID? Alam mo, Reina, that is an excellent question. Kasi how can you tell someone na mag-mask kung hindi naman siya naniniwala, di ba? Magmamask
Totoo,
lang
Dok.
yun habang nakikita mo. Pero later on, for herself, she's not gonna take that care. And when they enter your house, well, dala na po nila yung hindi yung nagiging consequences po ng hindi po nag-iingat. So that is actually a very, very good question, Reina. Also for employees ha, kasi you guys are working in the same work environment, kailangan yung prinsipyo nyo magkatugma. Okay? Kasi otherwise, that person is just following the social distancing and the mask because that was required by the boss. But the moment the boss is no longer looking at magkapantay lang kayong empleyado, patay. Diyan talaga mag-aaway. Kasi of course, wala na si boss. They will do what they want. So, Reina, this is very valuable advice also. And during this time, whether you work together, parang we realize na we are not an island. Yung attitudes po natin will impact upon ourselves and our family and the people that we live and work with. So, yun lang
Yes
po.
po.
Thanks for joining us. Ikalat nyo naman po yung video namin para mag-viral. We hope it's going to
So,
become viral. Because
ngayong
more than the
kahapon,
shoes and the tetanus, there's also the valuable message po that children need to be taught about nature. And to be very honest with you, pinilit ko lang ho yung anak ko. He's really, mga bata po ngayon, they are really not running out of the house anymore. Nung unang panahon, di ba, ikaw, Kat and Reina, hindi ba nung maliit tayo, people used to tell us na, oy, pumasok na kayo sa bahay. Ngayon, na sinasabi lang, oy, lumabas na kayo ng bahay. I mean, even, lalo
tama.
na ngayong pandemic, ganun eh. Children are afraid. And of course, we need to keep them naman, hindi naman pwedeng lumibot, pero there will come a time na hindi lalabas sa mga bata sa bahay.
Tama, Doc. Tama po. Doc, mabo lang po si Miss Emmy
Sige.
Manalo. Correct what you say, Doc. Isang pasasalamat sa ating creator na iingatan natin at pahalaga ng isang kagandahang binigay sa atin. Mag-iingat at sinasabihang kaartihan, ganun din po ako. O,
Yes,
di ba?
ma'am.
Hindi po tayo maaarte, Doc.
Kaya mo, mas maraming magbabanding ang mga arte na aminado pa. Okay? So,
Yes
sa
po.
inyo po
That's
lahat,
all po.
okay, so that to everyone ho, a very good afternoon. I would like to invite nga pala, I'm sorry, tomorrow is a very special day kasi po we have a special guest, very rare occurrence po ito. Our topic po is Parkinson's disease and movement disorders. Parkinson's disease po and movement disorders. We are joined by an eminent neurologist and one who is a specialist po talaga sa movement. Nako, Diyos ko, movement disorders. Mga involuntary movements. Ang tetanus may involuntary movement. So, ang Parkinson's din po. And dystonia. We are joined by Dr. Juno Bautista. He is part po of the movement disorders society po ng mga doktor na neurologist specializing in movement disorders and is a member po of the movement disorders clinic po and section on movement disorders po sa St. Luke's, Quezon City. So very rare po ito. Honestly, I am not a movement disorder expert. This is usually done by neurologists. So I personally am going to learn a lot from this. Okay? So what is Parkinson's? We may not know what is Parkinson's, but the most famous person po with Parkinson's is Michael J. Fox. He's an American po, and he has raised millions po for Parkinson's. Oh, what is Parkinson's? Si Muhammad Ali had Parkinson's. Siguro that's something that I would like to ask Dr. Juno kasi ang repetitive brain injuries usually happening po to boxers, Parkinson's disease. Very, very interesting question. Another third that I would like to bring up with Dr. Juno is vaccination po of the neuro patients. So, di ba magandang tanong yan, Arena? Vaccination of the
Yes.
neuro patients.
Yes, Doc, maganda po yan. Gusto ko po yan matutunan kasi hindi po yan masyadong pinag-uusapan. Pero madami na po ang nagkakaroon po ng ganitong diseases ngayon. Meron lang po ako nabasa sa isang group na Glam O Mamas, naghahanap po yung isang member po doon na ang tatay niya ay nagkaroon ng Parkinson's disease po.
And
Naghahanap po
yes, it's getting more common. People don't know much about it. Ako man personally, I'm not a Parkinson's expert, and I would like to also to let you know that we're going to be talking about a very interesting X-linked Filipino genetic disease, and this is Philippines dystonia. Yan. We're going to learn about that. Okay? So tomorrow
Okay
po, morning po tayo, 10 o'clock with Dr. Juno Bautista, neurologist, and our topic po is Parkinson's and movement disorders. Salamat po, guys. Ingat.